Welcome Doctors Rachel and Jessica Knox to the show.
Thank you,
Thank
Max.
you.
We're so thrilled to be here.
Yes,
so
thank you
thrilled.
for having us.
So, who are you? Let's just start there and give everybody tuning in at home a little context. Who are you?
Yeah, so we are 2 of 4 doctors, and we happen to be made up of our family, so our mother and father as well, who make up a group called the Canna MDs. And we are cannabis specialists who have just fallen in love with cannabis as medicine, as one of our major tools, our main tools that we use to help people, patients, achieve new dimensions to health.
I guess you really didn't have to go through the awkward phase of like telling your parents you're going to do cannabis, huh?
No.
No, and they roped us in. Our mother was actually like the leader. She 4 or 5 years ago sort of nosedived into the world of cannabis medicine. We were still in residency, and my dad followed her shortly thereafter, and we were just totally fascinated by what they were doing and felt like it was a much better way to practice medicine than what we were being trained in family medicine and preventive medicine trainings.
Shout out
That's
to Mom to
I know.
paving the way.
Yeah.
Cool mom. You got a
Totally.
cool mom.
So
She's a Berkeley grad,
Yeah.
so we probably should have expected this.
Yeah,
Maybe
Mom,
from
if
her.
you're watching, good work. So today, the purpose of this Green Flower Live class and our classes is education. And the topic that we had decided on today is the myths and misconceptions around cannabis. And I thought not only because you're MDs, doctors, but you're also practicing physicians, actually treating patients, so you can bring both the side of credibility from your knowledge base, but also from the kind of practical application. I thought it would be a good time to kind of dive into what is preventing people from utilizing something that I think we know is such a beneficial medicine. So I think the first just question to ask before we dive in is, at this stage in your practice, is cannabis really medicine?
Without a doubt.
Yes, absolutely.
Yeah. So we collectively as a family have seen thousands and thousands of patients over. For us, we've both been doing cannabis medicine for a year. For our parents, I think 2 or 3 years and 4 or 5 years. So we've seen a lot of patients. And I would love for anybody to walk up to any of those patients and try to tell them that cannabis is not medicine. Because these people have seen amazing transformations in their health when they weren't getting any relief whatsoever from our conventional medical system.
All different kinds of patients?
All different kinds.
Like who? Give us some example, not people.
Sure, of course. Yeah, I mean, anything from a chronic pain patient, which is probably what we see most commonly in our clinics, to patients who are suffering from really chronic debilitating diseases, things like cancer, epilepsy, Parkinson's disease, multiple sclerosis. It runs the whole gamut.
Yeah, from mental illness, mental health issues, to our physical, most debilitating conditions like cancer. I mean, we really are seeing everybody, young and old, the babies, the elderly, and everybody in between.
So it's really full range, it sounds
Full
like.
range, full range.
Probably useful before we dive into the myths. What can't cannabis treat? Because that's one of the arguments, right, that everybody has is, well, yeah, we know this treats everything, and we'll go into the science of that at some point, maybe not today or later, but is there things that you think cannabis can't treat, or is it really something that you think is beneficial for everybody, and why would that be?
Well, we have to talk about treatment in terms of symptomatic relief and cure, right? So there are things that cannabis, has the potential to cure. One of those things is cancer. And then we have conditions where cannabis really is more treating symptomatically, like pain. If you have arthritis, where that's a degenerative process, there's not a lot we can do to recover those joint spaces and rebuild cartilage, although science suggests that it can promote some bone healing and regeneration as well, but really using it symptomatically in that way. So it really is condition specific with respect to the degree of healing that we can achieve with cannabis. But can somebody benefit from it in one way or another? We do think so. We happen to believe that people who even seemingly or appear to be in their optimal state of health can use cannabis as a healing or preventative agent. We were talking before about, what is medicine? And medicine is a tool that we can use to prevent disease, treat, or even reverse it. And so, using that definition, we can broadly apply that to everybody, because there comes a time where all of us are a little down and out. I mean, we might be talking about just feeling under the weather one day, or actually having the flu, or, you know, God forbid, coming down with one of our more chronic debilitating conditions. Well, it does seem to me that cannabis can treat at least an aspect of every ailment that we come into contact with.
So let's dive into the first kind of real, most predominant myth. And, you know, it's funny, just the other day I was watching Jimmy Kimmel, and on Jimmy Kimmel, they had this little segment where they went out and they asked people, are you a medical cannabis patient? And it was so predictably funny, but predictable, right? Because it was like, are you a medical cannabis patient? And most of them were like, yeah. What's your condition? And then they start like, depression, you know?
Yeah.
And so my first question is it really a hoax, or do you think that people are really using it to treat real conditions? Like, is the typical cannabis user just the traditional stoner that everybody thinks of and makes fun of?
Mm-hmm.
I would say that the typical cannabis patient is not that stereotypical stoner. But we can't act like there are no sort of fictitious patients out there. We have patients who really, they're recreational users. They want recreational access to cannabis. It just so happens that they live in a place where they can only access it medically.
Yeah, and that's the screwed up part about the system.
Right, exactly.
You know, we should let them do it.
Yeah, exactly. And unfortunately, they are, you know, maybe giving all of the industry, all of the patients a bad name. But I would say 90% of the patients I see are real medical patients who are seeking some kind of relief with cannabis. And they're finding it. You know, it's not a joke for them. This is a very serious medication that they use regularly to feel better and to engage in their lives.
Yeah, and over the decades, really, of prohibition, people have been using cannabis illegally, and the majority of those people, while using it recreationally or as abuse, are medicating in some form or fashion. You know, anxiety and depression are two conditions that an overwhelming majority of people in this world are experiencing to varying degrees. No, not everybody fits the clinical description of the chronic type of those diseases. But even if they're feeling anxious, you know, every once in a while, why shouldn't they be able to use cannabis as a tool to give them some relief?
Yeah, it's, you know, it goes back to that real definition of what is medicine. And I've been kind of on a pedestal lately of realizing that, you know, medicine is designed to make us feel better, right, at the core. And either we feel better because we're sick, or we feel better because we're unhealthy, or we feel better because we're having a, you know, a bad day. And what right does somebody else have to dictate what medicine is for us as individuals? Myth number one is, you know, it's not really medicine. I think we can establish that that's probably true in some cases, right? People want to be recreational users, that's fine. I mean, what a funny thing, right? There's not a lot of substances in the world that have these two things that kind of dance on both stratospheres, right? But I think that doesn't take away from the fact that certain people who are really legitimately benefiting from this as medicine deserve to be treated legitimately, right?
Absolutely.
Number two, so there's a pretty common thought process that people have that prevent them from even getting into cannabis, which is that it's either highly addictive or that it's going to lead to some other kind of addiction, abuse, substance, that kind of thing. And it's a real fear that people have. So is it true? Does it lead to that?
Yeah. I'll start with the addiction piece. So cannabis has very low addictive potential, especially when we start comparing it to other drugs out there.
Food.
Yeah, yes, exactly.
Food.
Substances,
Yes.
exactly. So, but you know, if you do compare it to the addictive potential of something like an opioid or a heroin, a cocaine, alcohol, tobacco, it's very low on the totem pole.
Well, it's lower than tobacco and alcohol, huh?
Yes.
Yes. You know, statistics will put it at 9% of cannabis users will become addicted. I think that's probably an inflated number because that number is partly based on people who have, you know, been arrested and have gone through. Yeah, they've been busted for
and
cannabis.
They get sent to these addiction centers,
exactly.
right?
They get sent to an addiction center because it, you know, will knock down the amount of time they have to pay or whatever. But those people get lumped into, oh, these are addicted people, when in fact they're not. They just happened to get caught up in the legal system, and the way for them to get out of that was for them to go through
Right.
this process that then categorizes them as abusers or addicted people.
That's one of the things that's the most also interesting about the cannabis space is like what other substance or even subject in the world is also tied to criminal justice and industry and health and medicine. It's really like a phenomenal thing.
Yeah.
But anyway, I digress. Back to so addiction and then gateway thing.
Yeah, so people love to use the argument that cannabis is a gateway drug to some of our more illicit drugs out there in our society, and that's just not true. One distinction we have to make is that during the years of prohibition, cannabis was sold next to methamphetamines and heroin and cocaine. So when a person is, in an environment where those things are available, can we say they wouldn't make those choices to use those drugs? Well, yeah, they might. But even in those scenarios, a lot of patients who use cannabis are able to stop using those other drugs of abuse,
the
or they just
substitution
stop
effect.
at marijuana, well, is what they call it in that setting. But they use that cannabis, and that's typically enough for them. And so we don't think it's a gateway drug in the sense that cannabis use causes the use of other illicit drugs. It just happens to be in an environment in states that are still prohibiting its use to propel the use of those other types of drugs. In states where cannabis has been medically legalized or even recreationally legalized, we are seeing a decrease in the use of even those other illicit drugs.
And I think it's really important to bring up here also the consciousness expanding impact of cannabis. Because one of the reasons why I've now become a really proud, out loud kind of cannabis consumer is recognizing that one of the unique things that cannabis does is it shifts your consciousness in such a way that makes you more self-reflective. It makes you start to evaluate who you're being and the choices you're making. And I've found that actually becoming a more regular cannabis user has made me the healthiest, the most respectful, quite frankly, the best version of myself in the world by embracing my love for this plant. Do you guys find that in your own experience or in your patient's experience?
Yeah, absolutely. So from the clinical aspect, it's been very interesting to compare the patients I saw in the conventional world to the patients I see now. This is a totally enlightened group of people. I mean, wholly self-aware, just as you described, and open to using other natural methods and modalities to help achieve health. It's been very, very, very interesting. And really, that's one of the reasons that I felt so, drawn and compelled to learn more about it. Late in my residency, I started talking to patients about spirituality, about their mental health, and just talking about those things seemed to make a difference in their clinical improvements. Now bringing cannabis. Well, cannabis is the only thing that I know of to date that treats every aspect of health. And I always describe to my patients the sort of three-pronged health structure that make up us as human beings, and that's the mental, spiritual, and physical aspects of health. To be wholly healthy, we need to address every single one of those things. We cannot treat a person adequately in one of those compartments. Well, cannabis does all three of those things. So it's remarkable to see how different patients are in that space and in the cannabis world, where they are tapping into their spiritual and mental health along with their physical health, and vice versa, depending on what they're trying to achieve.
So one of the next main arguments, and I don't know if you saw that recent ad campaign about the sloth, the cannabis sloth. I don't know if you saw that. It's pretty bad, and it got a lot of criticism, rightfully so. But one of the prohibitionist arguments is that cannabis makes you stupid, right? That basically it kills your brain cells and it makes you dumber. Is there any scientific evidence for or against these things?
Sorry, I know, my face, I can't control it. It's just like this ludicrous thing.
The stupidity of it was getting to you, I could tell. But what do you guys know about the evidence of this stuff?
So we've seen no good, solid evidence that cannabis is killing brain cells. We in fact see it used. We use cannabis in young people and developing people to help manage things like autism or epilepsy, ADHD, and we're actually finding that, they are getting great relief from their symptoms. They're not having yucky side effects. They're more present for their families. Like these aren't signs that their brain cells are being killed or harmed in any way, shape, or form. So anecdotally, I certainly don't buy that. And there's no hard evidence that's coming out from science that is the case.
Yeah. Well, and in fact, our scientific studies are showing us that cannabis can be neuroprotective and neuroregenerative. So meaning that we're making new nerves, new neurons, new synapses in the use of cannabis. And I know there's studies underway for the use of cannabis in concussions and, some of our degenerative diseases like MS and stroke, so ischemic disease processes, Alzheimer's, dementia at large. So, why in the world would we be studying cannabis for the treatment of those conditions if it in fact causes brain damage and kills brain cells? Yeah. That makes absolutely no sense.
Yeah, one of our big supporters, Eugene Monroe, who's the NFL player, former NFL player, he contributed, I think, $80,000 to that study of concussions and cannabis. I also, not too long ago, watched a presentation from, I think Ellen Camp is her name, from the California Normal, and she was talking about how the mothers in Jamaica had been giving their kids cannabis as a tool for helping them improve their schoolwork and their performance in school, and that was a long-standing tradition in Jamaica for all these years. And I just thought to myself, I have pretty intense ADHD, and that would have been so great to me when I was, because I had a terribly rough time in school trying to stay focused without my cannabis. But so let's talk about the notion that it makes you schizophrenia. It makes you schizophrenia.
Causes schizophrenia.
It causes schizophrenia. What's the truth about that? I know that there's some interesting research on that as well.
Yeah.
I think this is like a sort of classic example of statistics read incorrectly, right? People will look at correlations and be like, oh, well, a lot of these schizophrenic people are using cannabis, then cannabis must cause schizophrenia. Correlation is not causation. It may be that patients who have schizophrenia are finding some relief from cannabis, and maybe that's why patients who are schizophrenic seem to be using more cannabis. So it's really easy to mistake this correlation for causation. We cannot say that they're one and the same. But what I really think it is that patients are finding relief with it. Because I have patients in clinic suffer from schizophrenia and get amazing relief from cannabis. I think the other thing that people maybe are mistaking as causality is that some schizophrenia typically comes on, the onset is in the late teens, early 20s, and a lot of times that's when people are maybe starting to experiment with cannabis. I think a lot of patients who end up being diagnosed with schizophrenia are already having some of those sort of physiologic changes going on in their bodies, and they're already just starting to self-medicate with cannabis. And that might look like the cannabis is causing their schizophrenia, when in fact they're actually just starting already this process of self-medicating before they've been diagnosed.
I think that's where the criminalization of cannabis use has done a lot of people a disservice, because a lot of these patients, they're diagnosed after, they stopped using their cannabis and they've been put into rehab programs to get off their cannabis, and boom, all of a sudden, they have a manifestation of these schizophrenic symptoms that they were otherwise treating.
One of the things I heard, I'm trying to remember what the documentary was. There was a great documentary a few years ago. Does anybody remember the Culture? I can't remember the name of it. It's a cannabis documentary. Anybody? No? Somebody at home will know this. But one of the things that they said in that movie that was just like, it was so great as a statistic. They said, in the last decade or few decades, cannabis rates have risen exponentially as it's gotten more popular, more widely accepted, but schizophrenia rates has stayed completely 100% the same. And so that was the statistical evidence that basically proved that this whole idea about, it causes schizophrenia was a complete waste of energy. And so do you guys still encounter people that are actively using some of these myths and misconceptions to stay away or to keep the movement from progressing, or do you think that it's starting to die down a little bit from your perspective?
Well, I mean, new patients are coming into our clinics all the time.
Culture high, there you go, right.
But yeah, new patients are coming into our clinics all the time, which proves that people are starting to reconsider cannabis. But in the clinical setting, I mean, we're getting patients who are ready for that encounter, but they're still telling us about their mother, father, aunt, grandmother who has a terminal cancer, who just flat out will not consider using this medication, not even as an adjunctive therapy in addition to their conventional methods. So prohibition, propaganda, these myths are still pretty significant barriers to use.
Yeah, it's got to be heartbreaking when you see people suffering as doctors and realizing that the mental block and the stigma is what's preventing them from taking a step forward. So what do you tell people in those situations? Because I'm sure that a bunch of people at home are watching this. They have family members who are suffering, and they have people that they know this plant could benefit them. So what advice do you have for people in those situations?
Yeah.
Slip it in their Jell-O. I'm just kidding. Don't do that. I'm kidding.
Dr. Knox.
No, I think the key to really turning around this stigma and this attitude that's still very much against cannabis is education. I don't know, maybe I'm a little optimistic about that, but I believe that if we can really help people understand that there is physiologic basis, we have the research to show that there are reasons why this plant works directly in our body to benefit us. My hope is that more and more people will understand that this is a legitimate, effective medication.
Yeah. You would think that the science would be enough, right? But we are deeply rooted really in institutionalized prohibition because of propaganda. So even the history of cannabis over really the centuries, I think is an important aspect to hit upon. When people realize how many lies we have been told and by our government, that gets people riled up. Let me tell you, people get angry.
When they find out the government has patents on CBD.
Yes, our government has had patents for years, over a decade, on the cannabinoids in cannabis. So on the one hand, government, you're claiming that this is a medicinal plant. And on the other hand, you're keeping it a Schedule I drug, claiming that it has no medicinal benefit at all whatsoever.
Right.
You
can't
gotta
have it both
question the
ways.
system, guys. You can't have it both ways.
It does. It makes you very angry
Yeah.
when you think, because what I always think about cannabis is this is a public health issue, and I think it's time that we continue to wake people up. But I think those of you watching and for the work you're doing, this is actually how you do it.
Yeah.
Better education, better role models, more credible dialogues that allow the conversation to move along. The question that came in is, how is smoking cannabis a medicine? I always like to say cannabis has a PR problem because, when we think about cannabis, we immediately get flooded with these images, whether they be, somebody that's just totally laid out on the couch or somebody that's just stuffing their face with Doritos. And then, of course, you also have all these images of people smoking, and you think to yourself, smoking couldn't possibly be healthy, right? Couldn't possibly be good for me. So is smoking bad or good for you in terms of cannabis? Is it considered medicine in your mind? How do you guys respond to that as doctors?
And I think that's a great question too, because that is a barrier that sometimes physicians will throw up as for reasons to not support cannabis as a medicine. Like, the only way to use it is to smoke it, so that's not healthy. Which is unfortunate because actually smoking cannabis can be very effective. We know that it's safe. There's been great research out of UCLA that followed thousands of cannabis smokers over decades. They don't have any higher risk of lung cancer, no higher risk of emphysema. At worst, they do have some more bronchitis, so irritated airways, coughing, sore throat, that sort of thing. But that's easily manageable. You can
Boy, I
switch
got
to-
some friends that got a wicked cough,
Yeah.
but that's about it.
Yeah, and oftentimes if they switch to vaporizing, those symptoms go away, or even tinctures or edibles or topicals. you know?
Yeah, but smoking it's a very effective way to deliver the cannabinoids and terpenoids directly to the lung tissue, where it gets absorbed very rapidly into the bloodstream, so you can get really, fast acting symptomatic relief, which is sometimes what you need for things like anxiety or migraines, panic attacks, PTSD. There are some conditions where you want to treat quickly, and smoking is a great way to do that.
And some doctors who are aware of those other methods of use, they'll tell their patients, well, do anything but smoking. And, I think we would both feel that that's not necessarily true either. Again, just like we have research studies that validate the use of cannabis by way of smoking. And so I don't think we should discredit that, but I do think we need to teach patients how to listen to their bodies, right? If you are having symptoms that are adverse, like a sore throat or a chronic cough, well, let's reconsider our method of use.
Yeah. And also, if smoking works really well for you and you're not having any adverse effects, by all means, continue medicating that way. That's fine.
Yeah, and I think that there's a few important things I would mention there too. Like, I remember talking with Brian Kroom, who's doing a lot of work with veterans and PTSD patients in New Mexico. And I remember him telling me directly, the smoking of the cannabis is one of the best ways for PTSD patients because it's the most sensory, creates the greatest kind of emotional comfort, and that ritual and that routine is actually quite effective in the healing process for people with severe PTSD. And I think it's also, just to reiterate, important to acknowledge the adverse side effects that have been proven are pretty minimal. So no forms of cancer, nothing that has any long-term effects. In fact, I think that's the other thing, correct me if I'm wrong, but what they also show with most or cannabis users is that any potential negative side effects that you have from short-term use pretty quickly go away if you cease use, right?
That's true.
Yes.
That's true.
Right.
I think in our more chronic users, it may take a little longer for those symptoms to dissipate, but they do. We're talking weeks to maybe a month it typically takes for those chronic users.
Yeah, and I'll say on my end too, I always do like smoking a good joint or something here and there, but I've found for myself that shifting to vaporizing and edibles is just a healthier consumption method for me. So I tend to prefer it, but I definitely don't feel like I hate on smoking.
Exactly. We don't hate on it. I think as doctors, we will always recommend vaporizing over smoking for obvious reasons. But really, if we're gonna knock smoking, then we need to knock tobacco smoking. Why haven't we figured that out yet?
Yeah, for real. Actually, that's funny. The next question was, are there any long-term effects of cannabis that have been proven or validated? So any science or study there that you guys can speak to?
So there have been a lot of studies conducted, and quite frankly, they're all over the map. We have studies that show that there aren't any significant long-term effects, and then we have ones that suggest that they do. And typically, the studies that suggest that there might be some chronic long-term effects that we would rather avoid, those are in patients or people who've been using cannabis very chronically, daily regular users for decades worth of time. And they have some cognitive deficits that they may be dealing with, some short-term memory issues. But again, over time, people seem to get those things back.
Yeah.
And I think I would just add to that, we know about cannabis that it is very anti-inflammatory in nature. And so I think, Rachel mentioned, the very heavy chronic users. I think if we're talking about a population that just sort of use cannabis in a more light, regular sort of daily, maybe baseline dosing way, I don't think we see those same effects. We're talking about people who smoke 10 joints a day or something like that. So, if we're talking about the typical cannabis user, I don't think we're going to see any of those long-term effects. And in fact, I think we're going to probably see better outcomes as far as dementia or, other inflammation-related diseases that we tend to get more of as we grow older.
Yeah, and I've looked at these studies trying to find out how they're even defining long-term chronic use. They don't even define it that well. It's sort of an arbitrary classification. So I would say the jury's still out, but we recommend intentional, responsible use when we're medicating with cannabis. Use your medicine intentionally. and for the reasons that you're suffering. You know, and when we use it intentionally in that way, I think we really do mitigate significantly any risk of long-term effects.
Let's talk about responsible use for a moment. You know, it's a big conversation we like to have here at Green Flower. I know we were having it earlier today too. What does that mean to you guys? What is intentional use, responsible use mean? How do you know if you've tipped the scale? What do you do about that in those situations? You know, as doctors, what does responsible, healthy use look like as a cannabis patient?
Yeah. So when we delve into dosing with patients, we really are recommending that they find that smallest effective dose. And that's typically where you get the most bang for your buck with cannabis anyway. You know, patients who overshoot that necessary dose often are using way too much medication. They don't get the effect that they want in the first place.
Expensive.
It's
Exactly,
expensive.
yeah.
So, you know, it seems the best method or best approach in using cannabis all around for both money-saving reasons and symptom or disease reversal reasons is using small doses that reach that, what we again call that smallest, most effective dose is how we describe it.
Yeah, and the intentionality goes to what are you trying to treat? What are you trying to relieve? What are the goals you have in using this medicine, and really bringing purpose to your medicine and to your dosing. You know, if you're simply looking for pain relief, like, you know, titrate up until you're getting that pain relief that you need. You don't necessarily need to titrate up until you're like conked out and no longer, you know, active in your own world. So responsible use means know exactly what you're out to achieve and be very mindful as you're working to achieve that. And once you do, like, that's where you're good. And I think, you know, I think it's possible to recreationally use cannabis responsibly, right? Like,
Definitely.
Yeah, so I think, you know, none of this is to say that you can't be a recreational user and be a good cannabis user. Like, you can use it in a recreational way, in a responsible way too.
Yeah. And I think we can say the majority of people using cannabis are using it responsibly.
I think so.
The majority of people who are drinking alcohol with their friends, family, or buddies on the weekend or wherever are using it, you know, responsibly. So there comes a point in time where we have to let people make good decisions
adults.
for themselves. And be adults. You know your limits.
Yeah. I remember having a dialogue with Uwe Bleshing. I don't know if you've met Uwe. He's a really charismatic guy. And we were talking about how important it is for you to participate in your own healing process,
Yes.
right? Because I do think that one of the other things that people don't quite have the right mindset around with using cannabis as medicine is it's going to do all the work and I'm just going to be healed, right? So do you guys have any, as doctors, and especially as doctors that favor kind of, you know, alternative mind-body medicine approaches, preventative approaches, what else is important to supplement with cannabis in the healing process?
First, I want to say that's an expectation in all sorts of medicine, especially in the conventional system. Even our pharmaceutical drugs.
Fix me.
A lot of patients are expecting it to work the first time.
Does that happen?
No.
Do doctors fix anything completely on their own?
No.
Right?
No. Yeah.
Important point though, everybody.
No. So yeah, cannabis does a great job, right? But we want to emphasize that nothing happens in a vacuum, right? So when I'm counseling patients on using cannabis, I'm also talking about nutrition. I'm also talking about mindfulness, intentional use. I'm also talking about their spiritual and their mental health as well, because that's how we curate healing. We have to bring in other modalities that are going to only enhance how effective cannabis will be for you. You know, if you have cancer and you're trying to use cannabis curatively and you're still chugging Mountain Dews 3 times a day,
Not gonna work.
you know, why should you expect to heal? You probably won't.
It's not gonna work.
You know, cannabis is great, but you can't fight our stupidity.
You said something. another tweetable tonight. You said something earlier today while we were filming that you believed that the mindset was just as important as anything.
Yes.
Huge.
So if you guys haven't read a book called The Biology of Belief by Bruce Lipton, you should, because it really delves into the physiology of mindfulness and how that can impact our health at a cellular level. It also bridges into the whole study of epigenetics, so our environments playing on our DNA such that our DNA now produces proteins and enzymes that reflect one condition versus another, which could mean the difference between health and disease even, and how even our internal environment, like our thoughts, can propagate health or sickness, depending on where your where your mindset is at. Yeah.
Anything you want to add?
No, you
Well,
you
just
did
to tie
good.
it back into cannabis, cannabis does work for many physiologic reasons.
Yeah.
But I would posit to believe that if you believe and know without the shadow of a doubt that your cannabis is going to be effective, it's going to be that much more effective.
Yeah, that's something I really started to pay much closer attention to is how am I setting the intent to use cannabis in a way that allows me to participate in the manifestation of whatever it is I'm trying to
Yeah.
achieve. And that really did change
Yeah.
my experience and my relationship with cannabis. I noticed I started needing much less than I was taking before to kind of stay conscious enough to interact with it. So the last question, I hope it riles you up a little bit. Are cannabis doctors really just a joke?
It would
No.
rile one up. No.
You think I'm funny? No.
No, yes. The answer is decisively no. I think, I think there have been some bad actors in the past, or even probably still, there are some bad actors in the
You
cannabis
think
medicine
they're playing a
specialty.
doctor on cannabis television?
I wouldn't put it past them. But by and large, we have more and more doctors who are really passionate about using alternative methods to help their patients heal, because a lot of us are becoming jaded with our own system that we were trained in because we see that it doesn't work. And so more and more of us are getting educated about the endocannabinoid system, about the cannabinoids, the terpenoids, really learning how this system works. And we're trying to pass that on to our patients. We're trying to be responsible. We're trying to help. We're trying to heal.
Yeah.
And so, yes, there are bad actors, just like there are the stereotypical Cheech and Chong, cannabis users. But those certainly don't reflect, I think, the bulk of cannabis doctors or the
they
bulk
don't.
of cannabis patients.
I really do feel it's time for doctors to rise to the occasion, whether it's an MD, a DO, a naturopath, a doctor of chiropractic, acupuncturist. I could list us all. It is time for us to rise to this occasion and meet patients where they need us the most. It's not enough just to write a recommendation. Patients want to know, what do I use? Where do I go to get it? How should I use it? And if you haven't become self-learned, you can't help navigate those patients through using that medication. And in the conventional space, if a patient comes in with a condition that we're not familiar with, what do? We go to UpToDate, we go to PubMed, we learn so that we can apply that knowledge to the patient's condition. Why is it so different with cannabis? Well, it shouldn't be. So, doctors really need to get onto the computer, look up the literature, read. There are CME courses out there. Green Flower has a lot of wonderful resources for healthcare practitioners to learn from. I mean, we really do need to consume as much as we can so that we can be the best advocates that we can be. I mean, we became doctors because we wanted to help people heal.
Yeah. So final words of wisdom for people watching at home, and I would point that in a few directions. One is if people are considering using cannabis as medicine, what are words of wisdom? If people are in the closet, any words of wisdom? Or if people are believing some of the misconceptions and that's preventing them from actually taking advantage of this medicine, words of wisdom. So any thoughts on any of those things to close us out here today?
Oh, yeah. So I think for the first and third groups in particular, right, the patients who are thinking about it and the patients who still don't believe in it, like educate. Like learn everything you can about this plant. And like Rachel was saying, there's so many great resources out there. The Green Flower, United Patients Group, Medical Jane, there are all kinds of places that really reputable places, I think, to learn about cannabis. And when you start arming yourself with knowledge and you know how to talk about it, you know how to talk about the cannabinoids and the terpenes and terpenoids and all these different terms, and you can relate that to medical conditions,
that's power. You're empowering yourself to go out and really take control of your health and to talk to others about it. And I think, I don't know, the second group's a little bit harder, the people who are still sort of living in the closet. Because there's a lot of reasons why people might still be living that way. But I would encourage them to start talking to people around them. Talk to your doctor, talk to your family about it.
Yeah, the people who are safe.
Yeah, exactly. And, get these conversations going, because the only way we're gonna lift this stigma is if we start talking about it. We can't, if we're all just gonna be in the closet, like not talking, like, I don't know what's going on over there. Like, nothing's ever gonna change.
And that goes for everybody, the patient who alone feels like they won't make a difference, and the people who are in positions of influence who are using cannabis and not talking about it. You guys, this is what, 2016.
You need to check your watch.
Yeah. Like, what age are we in? This is the time really for us to make a difference. I mean, we have all kinds of platforms from which to preach and share information. I would love to see a true paradigm shift with respect to cannabis as medicine, and that's only going to happen if people talk about their use. Because we could talk all day long about the science, but it's those people who are using it and are experiencing the benefit. Getting them to talk about it is what's going to bring this whole ship full circle.
All right, last question of the day then. What's your guys' personal preference? How do you guys enjoy your cannabis, and what do you use it for?
Let the record reflect that I've tried everything, okay? Because patients want to know.
Definitely.
One, have you tried it? And then two, I don't recommend anything to anybody unless I use it and believe in it personally. So I have tried just about every method of administration except dabbing. I won't go there. But I love topicals, tinctures, and vaporizing. Those are the methods that work best for me and that I'm most comfortable with using.
Do you have any strains you particularly like? Anything that's kind of a favorite of yours? Not so much?
No, I think I'm still myself sifting.
Finding the
What about you?
I swear by my 1-to-1 CBD to THC tincture for menstrual cramps. Like, takes care of them in under a minute.
Yeah.
That's my go-to.
Yeah. Thank you guys so much for being here. It was really fun.
Yeah, this was fun.
Welcome to the first Green Flower Live classroom.